At a press conference this past week, Detroit Police Chief James White said the system failed 22-year-old Porter Burks and his family. Burks' family called it murder and have hired attorney Jeffrey Feiger. The chief joins me now along with Eric Doa, who is the president and CEO of the Detroit Wayne Integrated Health Network, which serves 70,000 people here in Wayne County. Gentlemen, thank you for being here. And Chief, I want to tell you, I was at your briefing this week when you were discussing the Burks situation, and I was also in Dearborn on Thursday when Chief Shaheen in Dearborn said precisely the same thing that you said earlier this week, which is that his officers are being dispatched to a preponderance of mental health calls, and we have people who are in crisis and who are armed, and that this can't simply be a police problem, and that somebody needs to do something. So your people are on the front line. Surely you have thought about this. What, in your opinion, needs to be done?
Well, first, let me start by saying my condolences once again to the Porter Burks family. This outcome is not the outcome that we wanted, but the reality is we are handling a tremendous number of runs regarding the mentally ill, and it can't be a police matter. It just can't. We have great training. We have great partnerships with Detroit DWIN, but that's not enough. That's simply not enough. And when you look at the numbers that we're seeing, what I think needs to happen is there needs to be some concentration on providing long-term care facilities for those who are in mental health crisis.
Eric, your people face people in crisis every day, and especially people who have a poverty issue and a socioeconomic issue that can't just hop in their car and head to a hospital. Are there services available, and how do they access them if they are available?
It's a fair question. Let me first start with our deepest condolences to the Burke family. I mean, that cannot go without notice here that we're talking about a family that is hurting right now. And so we must do all that we can to make sure that our resources are put forth to making sure that that family is provided for. But when you talk about resources and services, we have a provider network of well over 300 providers, and we have about 65 plus outpatient providers. And these providers, who are clinicians, they provide these services throughout our community in every city you can imagine here of the 46 municipalities. When you talk about access to services, though, look, mental health knows no kind, no type, no economic, situations. But we do have to recognize that there is a health disparity. And because of that, there are some barriers, social economic barriers that do exist, social determinant factors that do exist. So when it comes to transportation, but this is some of the reasons why we have mobile services that we offer throughout the network. This is some of the reasons why we have partnered with the Detroit Police Department and other municipalities, because we recognize that this is not an individual problem. It is a community problem that's going to require community collaboration.
So the chief's people are called at 5 a.m. They get the 911 call from a family member in this situation that, they're worried. He's slashed tires on a car. Behavior is erratic, and they are concerned that he's out walking around with a knife out. Are you telling me at 5 o'clock in the morning, if I call the 800 number, that there is going to be something there that can help me?
Absolutely. Look, we are a 24/7 operation. You call that 1-800-241-4949 number, someone is going to respond. We also have, our partnership in terms of Hagera Cope. We have our partnership with Team Wellness. These are providers here who will respond. But we also have to note here, too, though, that you're talking a situation where someone is taking a weapon and they are either using that weapon in such a way that will cause some alarm. So the police is going to be called. There is nothing wrong with calling the police. Now, because of some of the training that Deep had, they are also going to reach out to our clinician to respond with them as well.
So, Chief, when you reviewed the videotape with us, you made a point that, at least one of the officers on that scene had been trained.
That's correct.
And when you see the video and you see him reaching out and in a calm, non-threatening, you're not in trouble, let me help you. When you look at that video, What do you see?
Well, I see the activation of the CIT training. And we've had tremendous success with CIT. We've had tremendous success having the mental health professionals work with us, particularly with our barricaded gunmen, getting out on the rigs with us and talking to these folks who are barricaded. When I look at what happened in this incident with Mr. Burks, I see the initiation of that training. I see the de-escalation, which is a huge part of that work, is talking in real sentences, try to get the person to understand what you're saying, to see if they have the ability to understand what's happening, ask questions. You'll note at one point when he asked him to put the knife down, he says, "I don't want to put the knife down." And he said, "Why?" To see if he's got the appropriate cognition, if he understands what's happening. The problem is, though, even with the assistance of DWIN, you've got unpredictable behavior in a weapon with someone who is mentally ill or in mental crisis. I mean, that's unpredictable behavior, and we have a responsibility to keep the community safe. We just had an incident in one of our precincts a few weeks back where we had someone walking through the neighborhoods randomly shooting people. So we don't have, time is not our friend in these situations. We can be patient and de-escalate and talk through people who are not actively engaged in violence. And talk them down and de-escalate the situation. But when you have someone who has a weapon, you have to control that environment very quickly because you have a responsibility to the community.
One of the criticisms has been that the amount of shots that were fired, and I've seen some community activists on social media saying not only did the mental health system fail this family and this young man, but why couldn't DPD say shoot rubber bullets or something along that vein? And your answer to that is, I'm assuming what you said at the briefing, which is you've got 3 seconds to make a decision.
Yeah, you have 3 to 5. In that instance, there was 3 to 5 seconds to make a decision. Again, none of us wanted this outcome. When I look at the video and the conversations that the officers had at the initial 911 call, we were there the night before with Mr. Burks knocking on the door with a knife. We were there that night. We were there months ago when Mr. Burks was on 6 Mile in a hospital gown, fighting with police officers. And each time we safely got Mr. Burks in custody or to the hospital. The last time, the night before the incident, he had left before we arrived. But none of us wanted this outcome. And when you talk about rubber bullets and things like that, listen, I never want to see this happen again. And we're going to look at every opportunity to be better. But the best practice that has worked over 90% of the time is the one that we deploy, and that's the CIT program. And absent him charging at the officer with a knife, we would likely have had the same outcome that we've had over 90% of the time. When things change is when the unpredictable behavior of someone who is suffering from paranoid schizophrenia takes off with a knife in their hand, and the officers have to make split-second decisions. But again, we are going to look at every opportunity to be better, best practices, but rubber bullets were not an option that night, and I don't know if they had rubber bullets, if it would have been impactful enough to stop that.
Eric, I've got to wrap this segment up, but I wanted to put out the plea. We're going to put the 800 number up for your organization. What do you want people to know? That if you call, there is legitimate help available?
Absolutely. Look, we are a resource within the community. We want to be a resource in the community. And, to families, to loved ones out here, individuals themselves, we want to help. We're here to listen. We are here to respond. And through the partnerships that we've developed with our law enforcement partners, our hospitals, we want to be that responsive, community leader here. So this is not something that we want to happen again. We want to avoid this in every way that we possibly can. And we are going to continue to work with our law enforcement partners and our community partners and stakeholders to ensure the safety of the community.
Gentlemen, thank you so much for your time.
Thank you.